Hi everybody, I hope you're all well. Today I'm going to be talking about your mouth during the menopause and give you some simple tips about how you can help yourself if you are suffering with symptoms of menopause in your mouth. So there are a lot of changes which happen basically as we women go through the perimenopause and the menopause, and we may start to experience some unpleasant and upsetting symptoms as well. Some of those symptoms can be experienced in the mouth. And I'm going to highlight a few of those, the more common symptoms for you, and give you a few tips that you can help yourself. So I'm Kirsty Broder. I'm a retired military dentist and stay-at-home mum. I help and educate women to improve their general and oral health through menopause and beyond. And it's my passion to help women to keep really healthy and maintain happy and healthy self-confidence as we get older. And we know that oral care and appearance has a huge impact on self-confidence in women, and I'm really here to help you. So let's talk a little bit about the symptoms that you might experience during menopause in your mouth. The most common symptom that many people suffer with is dry mouth, and that's known as xerostomia. It's quite a common symptom, as I said, particularly in women of menopausal age. Quite an unpleasant symptom when you get a dry mouth because it can affect your taste, it can affect how you speak, and again, that all has an impact on your self-confidence as well. Coupled with the fact that if you have less saliva, it puts you at increased risk of tooth decay, so it becomes super important for us to really manage our oral health to prevent those consequences from happening, basically. So secondly, you might notice that your gums bleed a little bit more. Now, I did a separate live on that, so you can go back and watch it if you want some more information on bleeding gums in particular. But during the menopause, we are more likely to notice that our gums bleed, perhaps more readily than perhaps in previous years. And even if you've never suffered from bleeding gums in the past, it actually does become a little bit more likely that you will experience more bleeding as you enter the perimenopause, menopause, and beyond. And the third thing I'm going to just touch on just now is that some women can suffer from what's called burning mouth as well. And this is a particularly unpleasant symptom, and it's associated with the hormonal changes of menopause. But on a positive note, these symptoms generally resolve once people get through the menopause itself. But it is a particularly unpleasant sensation of burning in the soft tissues, in the tongue, in the roof of the mouth. Really quite unpleasant. I think somebody's at my door and I'm otherwise busy. So these changes in symptoms can be experienced in the mouth. They are attributed to, they're caused by the decline in our hormones, specifically estrogen, progesterone and testosterone. They're the three key hormones that we have, and during menopause those start to decline and they just never recover, which is really sad. So these hormone levels just basically hit the boots. And all of those changes come together to put us at a higher risk of suffering tooth decay, suffering tooth loss, gum recession. We can suffer from oral ulceration and also an increased risk of oral infections too. So what can you do for yourself? Really simple, and top of the list has to be visit your dentist regularly, okay? That is kind of like the number one thing that you can do to help yourself as we're getting older to maintain our oral health, by visiting your dentist regularly. Secondly, make sure that you're brushing your teeth for at least 2 minutes twice a day. Really simple. Get yourself an electric toothbrush with a timer. Electric toothbrushes are recommended over a manual toothbrush for removing plaque and being more efficient and effective at cleaning your teeth, basically. And make sure that you're doing it for 2 minutes twice a day. So last thing at night before bed and at one other time during the day is recommended. Thirdly, try to make sure that you're flossing in between your teeth, so you're flossing or interdental brushing regularly to remove the plaque bacteria which is building up from in between the teeth that your toothbrush just doesn't get to, basically. We've got to get in there with floss or interdental brushes. Fourthly, make sure you are using a toothpaste that has a high concentration of fluoride in it. Fluoride is going to help to strengthen your teeth and protect them from the bacteria, from the acids, and also to prevent tooth decay. Thirdly, make sure you are eating a healthy, balanced diet. A Mediterranean kind style diet incorporates so many vitamins and minerals. It's going to help you. It's going to boost your general health during menopause, as well as being better for your teeth. And lastly, drinking plenty of water. Water being great if you do suffer from dry mouth. Frequent sips of water is the best thing you can do. Try to avoid fizzy or sugary drinks. Fizzy, even if they're diet drinks, it's actually the carbonated soda basically, which is acidic, and that can cause problems with your teeth such as erosion too. So there's 6 really simple tips which you can do for yourself to help manage the symptoms of menopause in your mouth. And if you are concerned about the oral health aspect and you would like some more information about how to manage your oral health during menopause, you can download my basic survival guide, or if you'd like some information that can benefit you specifically, I'm more than happy to chat. You can just message me directly. So if you would like to connect with you directly, just put like a smiley face emoji down in the comments below and I'll happily reach out to you. If you would like my guide, the basic survival guide, you can just drop the word guide down below as well. And I do have a group, it's a bespoke group for menopause and your mouth. If you'd like entry into that, you can just put group as well and I'll share that with you. Take care for now. I hope you have a super rest of the day and yeah, I'll be back here soon. Bye.